The only one that are able to survive at the moment are surgeons.
Oh, it is Roy De Vita, and he is married to movie star.
Not anymore.
Not anymore. You are one of the few Europeans who teach Americans.
I must say that today our results are unbelievable.
Roy, my life was changed.
It's you that can make a change in the world.
Roy, I'm so happy to see you once again. I think that you are the one dear friend who support the Moscow breast meeting for many, many, many years. I think almost every year, except of the COVID and
Yeah, exactly.
yeah. So, what is your opinion? What have you seen have been changed in from first one till the 11th? Because we are open the second decade of the Moscow breast meeting.
Unbelievable, unbelievable. How the time goes by. I remember the first edition, and I must say that you did a wonderful job. Because of Clovermed, that the level is so high, because the educational is so important. And you calls in the first moment some of the most outstanding surgeons coming all over the world, and something is changed along the time. Now I see beautiful presentation, and I must say that in the first edition, the local surgeons were not so, I can say,
confident or
yes, exactly. And now they do wonderful presentation, beautiful slides, wonderful post-op cases, and I think that the educational did its job. Something is really changing. You must be proud about that, because it's because of you.
yeah, thank you. I'm really proud, because my task was, and my idea was, that the Russian specialist will be integrated into international system and will get the best one from, let's say, from your mistakes, and will improve and will, of course, definitely create their own way, but taking in mind all this experience of the big masters, let's say.
They go around, they go and visit other surgeons, they can steal, other experience. Yeah. And I think it's wonderful, because you create a model of connections, international connection. It's very important.
Roy, I know that you are one of the few Europeans who teach Americans. What do you teach? I mean, what kind of things you present for them which they could not do, or they have a small experience?
Yeah, you know what's the problem? That they had a moratorium, and for 16 years they were not allowed to use the anatomical implant. 3 generations of surgeons never deal with anatomical, and it is not like round. You need to have a very precise pocket. You need to avoid the rotation, a lot of things. Then it's not easy. For them it's a problem, because few of us show them the beautiful results, much better than they, and the problem is that they started to think and to say something to scientific reason to go back using round implant. That's the problem. The most honest realize, because they are used to be the leader.
Conservative.
No, the leader. They are the leader. They are the best. And if there arrives something or someone that is better than them, is a problem, And and then now there are few Europeans that give results that are totally unbelievable, very beautiful. Why? Because we use all the implants. We use what we consider the best for this patient. They use just round, smooth. 92% of their market is round, smooth, you know? And you cannot apply the same technique for everyone. That's the problem. And then you have to understand how to deal with this kind of topic, of issue. Is a great issue. And to have good results, you can use everything. And they are not able to do it. That's the problem.
Are they running after Europe?
No, they try us to convince that are identical. They are identical, round anatomical identical. It's not true.
You concentrate more on science. You prefer to do sort of the science and then adopt your practice to the scientific results, or you like to see the practical results and, let's say, don't concentrate on the scientific data?
I must say that I am not so young because now I am 68, but my mind is very fresh. Then
that is more important than the age.
yeah, for sure. And then I try to, I'm never totally satisfied, you know. I think that every time there is something that can be improved, you can get better results. And now, for instance, I will present here in Moscow a technique that I use since a couple of years to preserve the nipple, but in a different way. With the huge volume breast where you are obliged to regraft the nipple areola complex, you have problem because you lose some characteristics. And for a woman, it's so important to have the real nipple. Then good results, but with the same nipple. And then I try to apply, answering your questions, I try to apply, according to the science, what I think is the best for a woman, you know, and try to improve your results. Because if you start to say that complications are always fault of someone else, you are the best results. You don't compare what you are able to do with others, and don't go to the international meetings, I think you cannot improve your practice. Impossible. It's very important to sharing experience, to see what other people does usually. It's very, very important. Meeting like yours, it's very important.
So in Europe, which country is, let's say, driving the science, driving the techniques?
Now, I can tell you that there are a couple of surgeons in each country that are very smart. Mm-hmm. A couple in Spain, a couple in France, a couple in Germany, a couple in Italy. Not a lot, actually. Mm-hmm. In Europe, 20 people that are able to do something different and something better.
And what do you think about the China, not healthcare, but China aesthetic?
But China medicine deal with different problems, you know. Before COVID, I went very often to China, and I talked to Chinese women. Rhinoplasty is a procedure in Turkey, so popular, in Italy too, but in Europe generally. And they try to reduce the nose. In China, they want to have rhinoplasty to increase the volume of the nose. You know, it's the opposite.
A different request.
Yes, exactly. Blepharoplasty. They don't have the Caucasian fold in the inner portion of and they want to have the blepharoplasty to move to Caucasian, to a European or Western model. You know, it's different. Then they deal with completely different patients.
Do you think that they will be able to teach Europe?
Never.
Never.
But never, because they don't know we in Europe, but in Western country, I mean Russia and US are inside. The Caucasian model is totally different. We cannot teach them, and they cannot teach us.
Because of the different anatomy.
Yeah. And different requests also. Then you can do, if you are a good surgeon, you can do anyway. But everyday life leads you in a different way.
You're doing a lot of reconstructive patients. Do you think that for that moment in 21st century, we get the optimal technique, optimal surgery with the optimal results, so and we don't have anything to improve?
According to what I said before, I am 68. When I started, the breast reconstruction with breast implant were awful, totally useless. Now are beautiful. I was invited twice recently at American Society of Aesthetic Plastic Surgery, showing my result in reconstructive. Can you imagine?
Wow.
It's unbelievable.
Unbelievable.
It's unbelievable because now I can show you many results that the post-op is better than pre-op. How is possible? We change everything, moving from retropec to prepec completely. Then the approach is totally different. It's much more natural, and the implants are very good. Everything is changed, and now I can say that I am very happy because we can release unbelievable aesthetic results in reconstructive. It's not true for 100% of our patients, but anyway, the majority of them, it's true. And it's really the great success that you could ever dream in the past. Not comparable, the results that we can have today. It's possible to improve. It's always possible to improve, always. Then we need to see what is the limits of
Improvement.
today, yes, of today technique, more than improvement, the today technique. I must say that today our results are unbelievable.
When you're doing the surgery with the patients, what is your, let's say, driving decision? Beautification, or you could say to yourself, no better results I could reach, and then I will keep it like that? What?
Are you talking about reconstructive?
Yeah.
I do everything. I do in this procedure from the first to the last step. I mean, I do mastectomy, I do sentinel node, I do axillary dissection if I need. Then probably I am one of the few surgeons, the plastic surgeons that do everything. Usually the plastic surgeon arrives later, after mastectomy. Then I can decide what is the best option for the patient. Because I think that you have one vertical surgeon that does everything is much better for the patient. Because, or otherwise you need a very tight cooperation. Because starting from the incision, where you put, and then you decide which is the best procedure. Always thinking as first to the oncological safety. From an oncological point of view, must be safe your procedure because it's the first, is a commandment. Then, according to this, what's the best procedure that can give us the possibility to have a beautiful, the most beautiful results that you can have, respecting the oncological point of view. That's the hit parade. Oncology,
So safety first.
Yeah, safety first.
The social media now is driving the image of the patient. And how often the patients comes to you and say, I would like to have these results? Does it happen like if you are not agree or tell to the patients, no, I am not going to do this kind of surgery and with this kind of expectation?
Social media are terrible. If I was a Italian Minister of Health, I could do something to provide the publicity on social media. Why? Because the majority of pictures are fake. The majority of they are just advertising. Is with nothing related to the science, nothing related to educational, nothing related to information. Everything is just to
sell.
collect money.
Yeah.
To get money. That's the reality. And then it's dangerous because the people trust doctors. I cannot understand why all over the world, just because we were a white gold, we are ethical, perfect, fantastic. No, we are human. And there are some people, some doctors, that from an ethical point of view is perfect, but there are some others that are terrible. Then don't trust doctors just because they are doctors. That's the first point. Then how can you protect someone that is not able to understand? Avoiding publicity, avoiding advertising. In this moment, social media is the way to collect patients, showing pre and post-op pictures. But the problem is that they don't, are like sailor, they don't, are not able to maintain promises, you know? That's the real problem. And it's normal. Sometimes when a patient comes to you and showing some pictures of an actor, or usually they don't want the same nose of, I don't know, Brad Pitt. They want the life of Brad Pitt. It's something different, you know. They hope that the surgery can change the life. No, the good surgery change your way to have your connection with the word, and not the opposite. It's not the word that will change, but the way in which you approach the word. I mean, if you increase your self-esteem, for sure, your behavior will be different because you are much more secure, you know, about yourself, about what you... And then it changed the way to have a relationship with the word. And it means that can change also the results that you can get, you know. But the surgery doesn't change anything. If you just look for someone else, I don't know, a woman that arrives and want to have breast augmentation, you discover that
she wants to get married.
No, their husband went away with a young woman with big boobs, you know. But he never come back if you do surgery. Then you need other reasons, other motivations.
Maybe bigger boobs, no?
No. The life is totally different. As I said before, doesn't change the world around you. It's you that can make a change in the world.
But tell me, probably because you have a big practice, do you have successful stories like you made a beautification of the lady and then she comes back to you and mentioned, Roy, my life was changed?
Oh, many times, luckily. Because, you know, when you don't feel in a comfort zone with yourself, because unfortunately, every one of us has the own body image. If you don't see that body image in the mirror, you look at the mirror and you see something that you don't like. That's the problem, because the balance doesn't exist anymore. And then you look for this balance and you try to have your body image that is very similar to what you see at the mirror. That's the probably the good reason to do something when you don't feel comfortable with yourself.
Roy, personal questions. Because my opinion, it is difficult to work as a doctor. I remember that we had a discussion with you many years ago, and you told me that no one doctor, even plastic surgeon, do not paid well because doctor should absorb all the problems which the patients get in the mind, in the body. So, and this is very difficult because you need somehow to concentrate with this patient and then to leave it away and forget about everything and live your own life. So what is your hobby and how you split this, like the patient life, which you save, and then your own life?
First thing, I never mixed the two words, you know. Then when I stopped work and I go back home, the work is not with me. I left in my office or in my hospital, if I can. Then what I do, I spend time to play golf, that I love a lot. In Italy, the climate is very good. You can play 12 months a year. I ski.
Wow.
I am a ski teacher, and I did a ski teacher for a whole university of my. And then if I can, I go every year. I go at least 1 week, 10 days to have holidays on skiing. Then I have many interests. I talk badly about social, but I am a lot on the social. I don't do plastic surgery. I do a doctor. I talk about scientific or medical problems, and I try to explain something as an influencer, actually, because now I have a lot of views. I have many videos that has more than 1 million, 2 million views, and but don't talking about plastic surgery, but about medicine from a general point of view.
About medicine in general.
In general, yes. And then, I have a lot of interest because luckily, when you get older, you don't sleep so much, And then I have sometimes late in the evening or very early in the morning.
But I mean, this is what I want to tell for our group who will listen our interview, that you are extremely famous, because I just want to tell you that in Dubai, in the middle of the night, almost 12 o'clock in the evening at the restaurant, I met in the elevator the couple from Italy, and then somehow we started to talk, and then I told them, "Oh, do you know who is your famous plastic surgeon in Italy?" They told me, "Oh, it's Roy De Vita, and he is married to movie star." I said, "Listen, yes, I know that Roy De Vita, but he's not married to movie star.
Not anymore.
Not anymore. It's next page. Next page."
Yeah, the reality is that I am very popular because, I had my TV show, and more than 20 years ago, I was very famous. I had a long love affair with an actress. And now with the internet, I do my videos, and then I'm very popular, actually. It's funny. It's funny. The people knows you everywhere. It's something strange, but it now became normal for me since many years. That happens, and but anyway, it's always nice to be recognized. People that ask you pictures more than autographs or.
More than your girlfriend, yeah. And in terms of medicine, what is your favorite topic?
But I'm a curious guy. Then I'm interested when something that attracts me. The last video that I posted this morning, I just recorded before coming to Russia, was about a topic that raised up Elon Musk. Elon Musk did an interview in a podcast called Moonshot, an interview made by Peter Diamandis, in which he said it's totally useless, continues to study medicine, because in few years the AI will cancel doctors. And what probably was too much, but I think he is totally right. And then I did a video on this issue, and I think that some specialties like, I don't know, radiology or dermatology or pathology is completely. They died.
Dermatology?
Yeah, they totally died, because the only one that are able to survive at the moment are surgeons.
Yeah, because AI could not do it.
No, just because no, they do, the robot can do everything. You know, in San Francisco there are cabs that are without driver. That's quite easy to inform a robot for doing surgery. The problem is the patients. We are too many over 55, and then it means many people, couple of generations, at least to the silent one and the boomers, that don't trust in a robot without a man. Okay? And then I don't want to have surgery if there is someone behind the robot to guide or how to drive. That's the problem.
So we are on the safe side. So we will
if you talk to your son, totally different generation, you will make a question. You will say that, yes, that could be acceptable. Not for us, impossible, you know. Then I think the surgeons survive just because there are old people that don't want to have surgery by a machine.
Very interesting concept. What is the future of the aesthetic medicine in Italy, in Russia?
Yeah. I think that the aesthetic medicine, it's an unbelievable field. That it increase a 2-figure every year. It's a business field, unbelievable, huge. You know, like gym. 20 years ago, how many people went to gym? Few people. Now, everyone. Why? Because the fitness and beauty and the model push you to be in shape, to eat healthy, and then the things, the dentistry. In the 70s, you could find some actress or actors with the theater were not perfect. I can show you many of them. Now, impossible. Oh, the teeth are perfect. Mouth are beautiful. Why? Because it's changed the way to think and the model are changed. Then aesthetic medicine goes in the same direction, doing the same things along the time. Then everyone will ask to have some fillers or something that can improve the beauty, you know? And it's very important. Then I think that will increase every year, and it's a field of companies can raise a lot of money. That's my idea. I don't think it is anything different in Russia more than in Italy or in France or in Spain. Everywhere, women and men, not only women, the entire population looks for something that can improve their aspect, you know?
Roy, and then the question, what we will discuss on the 12th Moscow Breast meeting in 1 year? What do you think will be the major topics?
I think that we have to say something about AI, the AI model in medicine from a general point of view, and I hope that it will be something new in a surgical approach. Be careful, because surgery is like a child. You don't see with your kids. You don't realize that he grows up every day. Just if you see a picture of when he was 6 years old and now, there is a word in the middle. No? There is a word. But at the everyday growing, it's difficult to realize. Surgery is exactly the same. If you go and see every day what is changing, difficult to say. It seems that nothing is changing, and it's not true. Because if you go and see 10 years ago and now, 2 words totally different. Then next year we will see something more. The baby is growing up.
Baby is growing up. Thank you very much. It was very interesting discussion.
Thank you, dear.